Okay.
Hello, everyone. This is Dr. Jennifer Hobson from the Breathing Channel. I am very, very excited here to interview Dr. Ira Shapira. He's a dentist. He has treated sleep and TMJ for over 40 years. He treats lots of chronic pain patients and growth and development of even young children. He was previously the assistant professor of the Rush Medical School Sleep Department. He just was appointed a professor at the International College of Neuromuscular Orthodontics. He's the editor of the craniofacial pain section of the Cranial Journal, and he's also the dental editor of Sleep and Health Journal. I'm very excited to have Ira here. Thank you for joining us, Ira.
Oh, you're welcome, and it's good to see you again.
Yes, thank you. So the reason I have Ira here is because there has been a big disconnect with the medical field around health around airway. And Ira is one of my colleagues that understands this part of the body. As a dentist, I'm a physical therapist that treats TMJ and breathing. The two of us work together, but we want to kind of educate the public around what we see in our patients and how we can maybe reach more people that are suffering from the same similar things. So I wanted to ask you, Ira, could you tell me describe your philosophy of your work? What is your philosophy? How do you treat these patients?
Okay, so to understand my philosophy, you have to understand where I came from. And I grew up, I used to have horrible pain, neck pain, jaw pain, TMJ disorders. I used to hear chirping in my ears like a field full of crickets, except I'd hear it in the wintertime. And if you tell people you hear crickets in the winter, they look at you like you're crazy, so then you just never mention it again. So I learned everything and anything I could about TMJ when I was still in dental school because I was looking for answers for myself. Life changed even more for me, though, because my son Billy, when he was 3 years old, he had big tonsils, he'd sweat at night, he never slept well, he was cranky, and he was kind of short and fat. And I'd go to the doctors and I'd tell them, and I was talking about getting tonsils or adenoids out, and everybody was saying, oh, there's no problem, he's gonna outgrow it, he's gonna outgrow it. When he got to be 5 and he was screened for starting kindergarten, they told me he couldn't start kindergarten. He had ADD, ADHD, he wasn't gonna be able to make it unless he was on a Ritalin all the time. Well, you know, when your kid hasn't started kindergarten yet and they're telling you he's not going to make it without being on drugs for the rest of your life, that's a scary thought.
Oh,
and I just told him, no way, just forget this completely. I ended up taking him to Rush. We did a sleep study. Turned out he had an apnea index of 60. He quit breathing almost once a minute all night long. It was like he was suffocating. Once we had this done, the same doctors who wouldn't take out tonsils and adenoids would. It was like, but we also orthopedically widened his mouth. We cut a tongue tie, we cut a lip tie, and in just a matter of a month, this cranky kid went from a 50% growth curve to a 90+% growth curve. It changed everything about him. He was still young, so he was still developing it, and you could just watch everything change. He ended up graduating college, double major, double minor, magna cum laude. Turned out his drug of choice wasn't Ritalin. He needed to breathe, he needed oxygen. And it's like ever since I've known the single most important thing we do with our jaw, our nose, our tongue, our teeth, is they hold our airway open. There is nothing we do as important as airway. And I know I have all these patients who come in and I always like to ask them, what do you think the most important nutrient in the body is? And everybody has their favorite. And they have probiotics and they take this and they take that. But the truth is the only one we can't live without is oxygen. That's the most important thing we have to do is correct the airway. So what do I think about stuff for philosophy? In medicine, there's a discussion or talks about form follows function. If we can correct the function, we can correct the form. If the form is wrong, sometimes we have to go backwards to correct the form and then still correct the function, which is why I work with you, because If somebody's 5 years or 10 years or 40 years old and they've been swallowing wrong their whole life, even if you can correct the damage that was done, if you don't correct the bad function, we're still going to have problems.
Can you just comment on that, Ira? Because people really don't understand swallowing. And why does swallowing give you such bad results? Or what does improper swallowing do? People aren't aware that you can actually be swallowing improperly, like a tongue thrust swallow or a grimace swallow, a lot of tension in your face swallow. What does that do to your structure, your form?
Okay, so forgetting about what an improper swallow does, if you start out what a proper swallow does. So a proper swallow, the tongue fills the whole roof of the mouth. So in an infant, as it fills the roof of the mouth and they swallow, they push out and they bring a high palate down and wider. And it's like, people go, so what? So they got a wider palate, who cares? But if they have a wider palate, they also have a wider floor of the nose. They're growing a wider nose side by side. They also move the turbinates outward, so there's more breathing space. And it's not just in one direction, it's two directions, because as the palate gets wider, it also comes down. So now two things happen. In the nose, we have a much better airway, and the nose is crazy important for everything. If we breathe through our nose, it's like driving a car with a clean carburetor. Everything works right. If you have a really narrow nose and you don't get enough oxygen, nothing works right. And even more important, we produce nitric oxide, the most powerful anti-inflammatory in man, when we breathe through our nose. If we don't swallow right, we don't develop proper nasal breathing. And it creates problems with sleep, but also problems with things like anxiety. If somebody puts their hand over your mouth or squeezes your nose and makes it hard to breathe, it's not going to take very long and you're going to be anxious. And it's an autonomic response because we need to breathe. We want to breathe. We want to be alive. And when we can't breathe through our nose, it's like we feel threatened. And it sets off a sympathetic overload. And we get anxious and we get sweaty palms, and people who can't breathe well at night go as far as having apnea where they quit breathing. They're suffocating, and then they wake up and they're suffocating, and they wake up and they're suffocating. And by the time morning comes, they're a disaster. And we think about it as being an adult problem, but it starts in kids. And the kids are developing personalities, their brains are growing, and it's so important to catch it early.
And these kids that I have patients that come in that have no idea what tongue tie is, right? And that their tongue is restricted to the floor of their mouth. And all that you're saying, swallowing, how does a tongue tie affect the swallow of a patient? And how does that affect even the ears? I have many kids that come in with multiple ear tube surgeries, and they're frustrated because their kid's always a little sick.
Okay, so it does it in a lot of different ways, but it's starting off, if a mother's trying to breastfeed her baby and the baby has a tongue tie, the nipple's supposed to go way back in the baby's mouth. But if the tongue is tied, what happens, the baby can't position the nipple to the right spot in the mouth. So when the baby puts their mouth over the nipple and they push their tongue, if they can't get it in far enough, it ends up where the mother ends up in pain. The mother can suffer terrible pain, and it changes how they respond to their baby if they're in pain versus not. When the baby can get it way back in their mouth, they literally push the tongue up against the nipple. They don't suck on the breast. They actually create a vacuum by dropping their tongue. So it's a pump. And as they pump it, it causes the roof of the mouth to get wider and the palate to come down. It also has to do with things like moving cerebrospinal fluid in the brain in these babies. And these first couple years of life is when the brain explodes in growth. So I talked about my son at 5 years old. I thought I was brilliant when I did it at 5 years old. Going back, if I had it to do over, I would have started at 3. I missed it by 2 years, but everybody kept telling me I was wrong. Oh, don't worry about it. He'll grow into it. He'll grow into it wrong, though, is the problem. It's our job to get him in the right spot.
You know, I just saw a child today, and you know, he's a 4-year-old. And the mom says, well, isn't it a little too early? I'm like, his teeth are so tight. His palate's really high. He's got this small little mouth and he's mouth breathing. And I said, you know what? You're going to need, in our team, you're going to need a dentist that understands craniofacial development. And it's not too young. It's when you intercept the problem. When you see there's a breathing problem, that doesn't grow out of the child unless you actually train them to breathe properly. But the structure of the palate needs the help of someone like you that understands growth and development.
Yeah.
So could you comment on that?
So again, I'm going to say I'm a really big believer in letting the body heal itself. But if we're swallowing wrong, if we have tongue ties, there's an impediment to healing. And what we have to do is remove those impediments. If they've had the impediment a long time, they start to form habits. So a lot of these kids will come in and they'll open their mouth and they got these big scalloped tongues on the sides of their tongue, all these grooves, and it's because they're swallowing with their tongue between the teeth. When you swallow with your tongue between the teeth, it causes the arches to collapse and the tongue gets more and more crowded and there's not enough room in the mouth for it. So what happens, it becomes like a car in a garage. If you have a big mouth and a big tongue, it's kind of like having a big garage and a Hummer. If you have a small garage and a small tongue, it's like having a small garage and an economy car. The problem is the kids who have a Hummer-sized tongue and an economy-sized mouth, they end up not being able to function at all. And in order to breathe, they pick up bad habits and tongue swallows, and it affects every part of their life because they also have a small airway, not just when they sleep, but during the day. And so immediately they start to bring their head forward and tip their head up, and they end up with that terrible forward head posture. And you know this from Mariano because you teach with them, but as the head posture comes forward, the muscles all the way to the low back work twice as hard for every centimeter forward. And now we have a whole adult population of people suffering with back pain, and we don't even tie it back to how they developed. But that airway is, again, the most important thing. We need it to breathe. The kids don't look right. It's called adenoid facies. And it's like, you can look at them, I can look at them, and we can see, oh, this kid can't breathe right. We don't have to ask, do they have stuffy ears or sinus problems? We can look at them and say, we know they're not breathing right. We can see the dark circles under their eyes.
Yeah. Yeah.
If they have dark circles under their eyes, they have blood without enough oxygen. Either the blood's not draining out or it's not getting oxygenated going in. So it's like, it's our job. We're detectives. We have to pick on the clues, figure out what it is, but we know they need to breathe, they need a wide open airway, and they need to function properly. They can function improperly. The problem with that is they still function, they just don't function well. And so what happens is they create repetitive strain injuries. I like to give the example, since normally we should swallow about 2,000 times a day. So if somebody eats 2,000 times a day, and we see people like this all the time, they never get a sore elbow. They do get fat, but they never get a sore elbow. But if they just change their posture a little bit, and instead of going to their mouth, they went to their shoulder 2,000 times a day, and they did that for a day or two, they would be so sore. I had one person who didn't believe me, so he tried it. And then he called me up and said, how do I fix it? It took over a month for him to get back to normal function. And now we have these kids who are functioning wrong hour after hour, day after day, and they're doing it with a bad airway. And I was telling you before, because of the faces, they did research at University of Michigan with Dr. McNamara, and they looked at kids who had genius level IQs and these adenoid facies, which is the allergic face. And they found that the kids, when put in classrooms with teachers, and they put other kids that had average IQs and perfect little pretty faces, they were good breathing faces, basically. And the teachers would call these genius level IQs by negative adjectives. They're slow, they're dull, they're problem children, they're fidgety, they're this, that. And the ones with the average IQ and pretty faces, they go, they're smart, they're helpful and intelligent. And the kids have this inner sense. They know how, when they look at us, they know what we're thinking. And so people respond to how they respond to them. So these kids start off at a very young age on the negative half. They're going in the wrong direction. And it's because that's how they see people seeing them. So it's crazy important. Anything in dentistry and anything in medicine, the most important thing ever is to make sure we give people a good airway. And that's—
Ira, these patients that don't get intercepted as children, what do they become as an adult?
So that's the bulk of the patients I treat, because I don't really like treating really little kids. If there weren't good people around who did, then I probably would have to treat the little children, but I love treating the adults. But the adults I'm treating are chronic pain patients, they're patients with anxiety, depression, TMJ pain, headaches, migraines, cluster headaches, trigeminal neuralgia, myofascial pain and dysfunction, fibromyalgia. They have this whole list of complaints. And then my male patients are more the sleep apnea, snoring, gastric reflux, but they all have the same structure. And that structure follows a developmental path that started from birth. The scary thing is, in the last 400 years, the structure of humans has changed. They've actually been able to track this via anthropology. And about the time of the Industrial Revolution, all of a sudden we started to get pollution and all these other things happening. And now they show, even in fetuses before they're born, there's changes. And people don't breathe as well, there's more allergies, and then we add formula. Formula is made from breast milk. You may not know this, but breast milk is the perfect food. Or I'm sorry, cow's milk is the perfect food, except not for humans. It's for baby cows. When you give it to baby humans, they get more allergies.
Exactly.
So the first thing we do is we put this chemical assault on the babies. They start to get allergic and chemical changes in their nasal mucosa. And then in the sinuses, they get more cells that make mucus and less that make watery. So it builds up all this mucus. And inside of our sinus, we have these little fingers called cilia. The cilia move all the crud out. But if you get so much mucus, it gets stuck in the muck. And then everything gets breathed in and stuck. It makes it even harder for them to breathe through their noses. And they're not being breastfed, a lot of these kids, because mothers have sore nipples. Big reason. If mother's in agony, because when she tries to breastfeed, she won't do it as long. And one of the common causes is tongue ties. So it's like the gift that keeps on giving forever. And because of this, 50 years later, the baby dies of a heart attack during sleep from sleep apnea. So our goal is always to intercept and make the corrections as soon as possible.
Yeah.
But we don't fix them. We don't fix them. We just let them develop the way they were meant to. We have to remove the impediments to healing. So
is it true? This is, I understand airway and breathing, but a lot of people don't get this. And the nose, the deviated septums, right? We have so many people with bent noses, and they've never had a punch to their face or a fall in their face, but why are they getting these darn bent noses? Okay, so it's a very interesting question, because people don't relate it to breathing or tongue tie or low tongue. So what can you say about why do we get bent noses, and how important is it to get it fixed? Okay, so this is important because it has to do with inheritance. We inherit genes from our parents, but there's two types of genetics. There's regular genetics, and then there's something called epigenetics. So the genetics is the hardcore gene. It's what's in writing. It's like the hard drive on a computer. And our hard drive on the computer says the septum in the nose is going to grow this long. But epigenetics changes how the jaw develops.
So if we're swallowing wrong and we end up with a lower jaw like this, we have a very short nose. And then when that septum grows to its predetermined, genetically determined length, there's not enough room for it. So it bows one way or the other. If we can correct that high palate and bring it down and wider, then the septum can grow to its proper length and it straightens itself out. It's meant to be straight. It's a midline structure. Midline structures, we don't find people's big part of the nose way out here because there's nothing obstructing it. And it's really sad is because people go through a nasal cycle. So when they're sleeping, if the septum's all the way to one side, they have a good side to breathe and a bad side to breathe. When they sleep, one side will swell shut for 60 to 90 minutes, and they breathe through the other side. Well, if the bad side swells shut, they're fine. 60 to 90 minutes later, they wake up with the other side swelled shut. Now they have to breathe through the bad side, and then they wake up feeling like their nose is all stuffy, and it usually feels really stuffy on one side. But that side is the side that had the big airway, not the small one, because it's forcing them to breathe through the small airway. Of course, you do mouth taping and you teach people proper breathing, and it's amazing with mouth taping, they breathe through both sides, but that's your field.
Right, right.
Because of you, I tell a lot of people to do it, but I also go tell them to see you. Because that's, mouth taping is great, but it's a piece. And it's always a question of covering all the bases, top to bottom.
Before we get into the appliance treatments, just one comment. You mentioned Mariano Roccabato. I know he's my mentor. You've trained with him. He's trained many dentists to look at the body and the occlusion from the back of the head forward, right? So the spinal posture of the neck and the natural curves of the spine are important to health of the body.
Absolutely.
Now, how important is this balance of the body, the pelvis being aligned, the collarbones being aligned, the atlas, the neck, the curves? How important is this? And could you share with the audience how you work with PTs like me or chiropractors? How do you work with them to make this optimal outcome?
Okay, so that's important. So the dentist actually has one of the easiest jobs in the world, because when we use the jaw joint, they open up. The jaw rotates and slides, but we have two jaw joints and teeth. There's an end point for the joint. It's a reset. If you make that reset point correct, every time they close their mouth and swallow correctly, they reset their neuromuscular system. They send positive input into their brain. The problem is that the whole body's out of whack. Everything is fighting that. So I always like to use I say that people like you, whether it's chiropractors, physical therapists, massage therapists, the people who work on the thoracic spine, it's like it's a 6-foot rope and they have a 5-foot arm stretch and now they're trying to hold it straight. And it's almost impossible to do unless you make the end points right. So one end point is the mouth, the bite, but another one's when you sit down and it's the hips. And a third one is the feet. But the endpoints can be changed. And we've been talking about doing a research project together because we work with a hydraulic appliance, and you can put it in somebody's mouth and change the hip height when they go up and down a flight of steps. And that's because they have abnormal curvatures in their spine. So I kind of like to think about the spine like being a long slinky. You take one of those slinkies like we used to play with in high school, and you stretch it out and you put a wave through it. And that wave will come up and back, down through the whole slinky. And it's like, it'll change each time. So if you're not aware of this stuff, you come in and one time somebody has a pain in their upper back and another time they have a pain in their lower back. But if you don't understand that it's because of the abnormal curvatures, the muscles are always going to be too tight on the inside of the curvature. So on the inside of the curvature, you get myofascial pain, dull, achy pain. But on the other side of the same spine, you can get sharp shooting pains or sciatica pain because that's where the structures get displaced. So we need to diagnose what's going on. And whether it's dentists, physical therapists, physicians, if we're not working together as a group, we all know what we do well, but we don't know what everybody else does as well. And so we have to put this team together that lets us correct all the parts, because no matter how right you make things, the weakest point will always be the one that gives. And if the weakest point is the jaw, you get joint problems. But if the weakest point is the low back, you can get a slip disc because of a forward head posture. You have to get it all right.
Now, I want to make sure we spend a tiny bit more time on explaining what you do as a dentist. Now, I've heard great things about the DNA appliance, and I know there's modified appliances that help airway development for adults that are already, formed, and they've gotten all their years of bad breathing. They have the high narrow palate, they have, either a tongue tie that was never diagnosed, and they're mouth breathing. What can you do as a dentist at this stage of life?
Okay, so for 35 years of practice, or for 30 years of practice, I pretty much said, boy, you can do surgery. About a little over 10 years ago, we started doing DNA and RNA appliances, and it's incredible. Bone is plastic. You can grow it. You can grow a bigger airway. Dr. Singh, who invented the DNA and RNA appliance, calls that a process of pneumopedics. We do orthopedics. We grow the bone. Pneumopedics, kind of a made-up word, but if you think about buying a donut at Dunkin' Donuts, and if you can grow the outside of the donut bigger, the hole in the middle will also get bigger. And now there's more room for airway. If you're looking at the mouth, if you grow the mouth wider, there's more room for the tongue inside the mouth, and the tongue will come forward where it's supposed to be instead of falling back into the throat. When you bring the tongue forward in there, it's connected to a little bone in the neck called the hyoid bone. The hyoid bone is the only bone in the entire body that doesn't connect to any other bones, but it does connect to the suprahyoid and infrahyoid muscles. And if your tongue and your jaw is too far back, your hyoid bone's too far back, and your head's forward like this, and then you're rotating your head to see where you want to go, and then you have upper cervical problems, and you also have, and we live in Chicago, so we all know what the S-curve is. There used to be an S-curve on the outer drive. Good weather, bad weather, never mattered. When there's that S-shaped curve, the traffic would slow. Even on a perfect day with light traffic, it would be slow. Everybody with a forward head posture has an S-curve in their breathing. And you can talk to any heating and air conditioning guy in the world, and if you want to have a good air supply, you have a straight air supply. You don't put all sorts of curves and bumps in it. So every single part's connected. If you can correct the jaw, it makes the body want to have everything else in the correct position. But that doesn't put it in the right position. It just allows it to be in the right position. And if somebody's got all these bad habits and changes in their body from being in the wrong place for years, you still have to correct it. So about half of the patients I see that we give DNA and RNA appliances to, we start out with a TMJ appliance. Sometimes they come in because they had a dislocated jaw, they got locked. Sometimes they're having chronic headaches and migraines. It doesn't really matter what brings them in. It's usually fairly easy to fix that first part, and then we need a long-term solution. And you're looking for a long-term solution, but they never developed the right airway. Do you know who Shimshak is? Are you familiar with his research?
No.
Back in 1997 and 98, it's Dr. Shimshak, not a dentist, not an MD. He's an actuary. He looks at numbers. He looked at insurance numbers. But what he found was that people who had TMJ disorders had a 300% increase in usage of medical insurance in absolutely every single field of medicine except obstetrics. And I had an article in a book, medical textbook on anti-aging medicine back in '98. And Shimshak's article had just come out. So it's like that was the last new reference to the article that I put out. But it was like, we thought, oh my God, the TMJ is everything. It's all about jaw joints and teeth. But what we didn't really realize is that every one of those patients had an airway problem. Every TMJ patient has an airway problem. Every forward head posture patient has an airway problem. And so when we address the airway, everything can be corrected long-term. Better yet, if you have little kids and you take them to them and you teach them how to swallow and grow a bigger airway, you avoid a lifetime of suffering. It's like sometimes we think, oh, all people want to do is feel good. The single angriest patient I ever had, lovely woman married to a radiologist. She brought her husband in because he was snoring and had sleep apnea, and we made him an oral appliance to treat it. And the whole time we're there, she's sitting like this, holding her head and in pain. And I said, do you have a headache? Can I take it away? And she said, no, nothing takes my headaches away. I've had them forever. And we used one of those little hydraulic appliance. We did some spray and stretch. It took about a minute and a half and her headache was gone. She was pissed. She'd had a continuous migraine for over 50 years. She'd seen her radiologist husband and all his doctor buddies, but nobody ever noticed the posture or the airway or the breathing or the jaw. But she had had all sorts of x-rays and tests and medications. It's the simple things that make things work right. And you and I are both in the same business. Taking away the things that let people heal out of the way so they can heal.
And that's what I tell lots of patients that don't understand, half of it is learning what you're doing wrong to correct it. If you never know that you're doing something to hurt yourself or to keep things chronic, you'll never know how to improve them. So one of the things I wanted to say is I was really impressed by your way of doing a sleep study throughout the treatment, and to make sure that the patient understands how they're breathing and their breathing structure, their nose, their throat, airway space affects their sleep. The treatment that we do, either the body treatment that I do, the breathing training that I do, and the expansion that you do, how that changes through the treatment. And a lot of people are anxious to get, through the treatment faster than they should sometimes. And everybody wants things quickly, everybody either wants a pill to get their problem to go away, but the work that it takes to actually change this airway, it takes some time, right?
It's a process, and to grow somebody out of apnea can take 2 years or more. So I had one patient we talked about earlier, had severe apnea. Now, severe apnea means they quit breathing 30 times a minute, up 30 times an hour or more. They have an apnea hypopnea index of more than 30. So first thing, just the way we measure sleep isn't always the best. So we can do a full sleep test and we can do a home sleep test. And a home sleep test started out as a screening method, but it's cheaper. So insurance companies don't always want to pay for a full sleep test. But on this one specific patient, he had severe apnea. We treated him for many years with an oral appliance. He wore it every night, but he wanted a more long-term cure. So we said, we're going to grow him the bigger airway. Now I tell everybody, we can't guarantee you're going to get a complete cure, but he wore it for 2 years, and it's a little bit bigger appliance and you have to wear it for 14 to 16 hours. So it takes commitment. At the end of 2 years, he was like, okay, I'm done wearing this thing. If I still need a sleep appliance, I'll wear it because I don't mind it. So we sent him out for a sleep test. But I didn't do a home sleep test. We did a lab test. And when the first 2 hours of this night, he slept with his appliance in. He had perfect sleep. Everything was good. The sleep staging, everything was perfect. After 2 hours, he took the appliance out. He still didn't have any apneas or hypopneas. He had an AHI of 0, which is what they say that's healthy. Except it's not healthy. Actually, they say anything less than 5 is healthy. But it wasn't healthy because he had a horrible sleep pattern. He didn't have the right percentage or timing of sleep, and he had arousals all through the night. I convinced him to wear the appliance for another 6 months. I don't like to push, but I always like to measure. I do neuromuscular dentistry, and Barney Jankelson, who taught me, said, if you measure it, it's a fact, and if you don't measure it, it's an opinion. So I always like to measure and know the facts. 6 months later, we did another sleep test. He did the whole night with nothing in his mouth. And he had no apnea, but he also had perfect night of sleep. He had the right sleep staging. He didn't have arousals. And the hardest part of the whole battle was getting the insurance company to pay for another sleep lab in the lab, a sleep test in the lab, because he said, well, he didn't have sleep apnea last time. Why do we need to restudy him? But the only way you can know what you have is to actually measure it. So it's crazy important to understand. I'm lucky because I spent years as an assistant professor back in the 80s into the early 90s, and then again in the late 90s into 2000, looking at sleep tests and studying it. And it was all because of my son. I ended up there by mistake, but it changed everything I've done ever since.
So not many people understand that if they're just not sleeping well, it's not just like, let's ignore it. You know, a lot of people just kind of, oh, I'm tired and I'm struggling to stay alert and awake. And these are the same patients that come in, but sleep studies are not commonly thought of for patients to get. And a lot of physicians don't always think, have you tested their sleep?
Now, I'm amazed how many patients come in who are complaining that they're tired or they can't sleep, or and the physician has given them a sleeping pill or something to sedate them so they fall asleep at night. And the problem is they're already not breathing well, and now he gives them something that makes them breathe less well. And when you wake up not breathing, it sets off almost like a mini panic attack, except sometimes you're not even aware it's happening during the course of the night. And it puts you into what's called sympathetic overload. You're stressed out all the time. And as you know, people who are stressed out all the time, every muscle in their body is tight. And like you have to calm them down. So the best way to calm them down is give them good sleep. But I also do a lot of something called sphenopalatine ganglion blocks on my patients, where we can reset their autonomic nervous system. It's a treatment of choice for things like cluster headaches and migraines. But I've had a patient come in once who came in because she was getting chronic migraines all the time. So she came in to get an SPG block for her migraines. And we did it. And within about a minute, she said, is this what it feels like not to be anxious? She'd had anxiety for 42 years and it went away. What I find though is most of the people who have a lot of anxiety also have a lot of sleep disorders. They're not getting good rest.
If you had advice for any parents that had issues with children that were always kind of a little sick, couldn't breathe through their nose well, you know, mouth breathing, ear tubes, can't hear well, sloppy eaters, talking with their mouth full, what is your advice for parents? Because parents don't really know what to do. What would you tell your family member?
So in a perfect world, I would tell them see the pediatric dentist, see the orthodontist. However, most of them are going to ignore the airway problem. And you talk about the stuffy ears and the ENTs. If somebody can't hear through their ear well, especially if it's only one side, but even if it's both, they'll start to twist their head so they can turn their ear to face whoever's speaking. Well, now they have a sternocleidomastoid that gets messed up. They mess up their trapezius, so they mess up their body posture. So what you want to do is you want to have somebody who can do a thorough job evaluating their breathing and how they're functioning. And the younger they are, you want somebody like you. You want somebody who's going to actually look at for the tongue. Now, every dentist should look. Every OB-GYN should check kids for tongue ties. The only country in the world that does that is every newborn baby in Brazil is checked for a tongue tie. But an oral myofunctional therapist is so aware of this. And most of the people I know who go in for tongue ties are going in because they've been diagnosed as having a problem because of the oral myofunctional therapist or because of somebody who's helping them with breastfeeding, because the women who help women breastfeed understand that if there's a tongue tie, it doesn't work. The reason in Brazil they check every newborn baby is because in Brazil, the oral myofunctional therapists are part of the speech pathology department. And if you're a tongue-tied, you can't speak Portuguese, you can't roll your R's.
Right.
In this country, everybody should be checked at birth for a tongue tie, because if you can't breastfeed, it's starting your life with 2 strikes against you. And it doesn't mean you're not going to make it. You're just never going to live up to the possible potentials you had. We always want to give everybody every chance in the world to grow to their fullest potential.
And now what advice would you have for an adult that missed that opportunity of changing that in the pattern of growth and development as a child? Now they're an adult with a bent nose, mouth breathing, or just feeling exhausted, headaches. What are the steps you would take as advice for these patients?
Okay, so I divide my patients into 2 groups. If they're having a lot of pain and dysfunction, first thing I want to do is make them feel good. I want to find a stable spot where they function well. But once we have them functioning well, we have to do something long-term. And long-term, my choice of treatment, so I don't want to say it's the only choice, but my choice of treatment is to grow them a bigger airway, orthopedic advancement if they need it. 12 years ago, I would have sent them for something called a SARPI procedure, or a surgically assisted rapid palatal expansion, because it was less invasive than orthognathic surgery. Now I find surgery is almost never necessary. I think that's fabulous, because one of the things I tell my patients is there's no disease or disorder known to mankind. It can't be made worse by sticking a knife in it. And it doesn't mean never do surgery. It means always approach surgery with great caution, because a lot of people have bad effects to it. And if you are going to do surgery, make sure you do the right surgery and make sure you have the right diagnosis. And that's the #1 thing that is absolutely essential. It's why I work with you, because I know a lot, but I don't know everything. And when you look at it, you look through it through a different mirror, and you see different things than I see. It's like, I've been doing sleep and breathing for 40 years, but I've only been knowing about mouth taping for like 5 or 6 years. But about 20 years ago, I figured out that every young mother, if they weren't a singer or an athlete or played a trombone or a trumpet after they've given birth, they no longer do diaphragm breathing. Because when they were in their ninth month of pregnancy, they couldn't breathe with their diaphragm, so they stopped, but only for a few weeks. But that was enough to form a habit.
The habits form then.
And the habit form, and then they never go back if somebody doesn't teach them to go back. And sometimes they spend the rest of their life not functioning right because they haven't been taught to breathe right. And again, this is stuff you know better than I do, but the scalenes get tight.
Yep,
And if
right
the
there.
scalenes pinch on the blood vessel, they get cold hands. And if it pinches on the nerves, they get numbness and tingling and weakness. And the only way you correct it, and you don't start doing surgery on the neck, though we see that, the only way to correct it is correct the malfunction. Because as we always say again and again, form follows function. Proper function, proper form, improper function, pathologic form. We have to get everything in the right place at the right time.
Dr. Ira Shapira, it has been a complete pleasure having you on the Breathing Channel. Thank you so much for sharing your knowledge and really helping us share this to the public. This is information that not many people hear, and it's important. It's really the healthy way. We kind of nudge the body and the breathing apparatus to breathe properly so we can be healthy without the need of surgeries and things like that. So thank you.
Okay, and thank you for all your work, and thank you for everything you do for my patients. It's really appreciated.
You're welcome. Thank you so much.